So, the operations. One last thing before we talk about the operations. I just want to touch on it because it's important. I mentioned it earlier, and I just want to make sure we understand. Exercise. We talked about exercise earlier in that it can help with metabolism because it can burn calories. Exercise is a very important part of any kind of weight loss program. It's also very important for health because it improves your heart and your lung function. So we recommend it. It should be a part of any part of a good weight loss program. However, what I want to stress is the importance of understanding where exercise comes into play versus food and diet. So even after surgery, the most important thing for you to lose weight is the food you eat or the diet. Not a diet like a starving diet like you're used to now, but your diet. The second most important thing to losing weight after surgery is your diet. The third most important thing to lose weight after surgery, diet. In other words, exercise, calories, it's a little bit of a myth, but you do not burn a significant amount of calories when going to the gym. You burn about 10 calories a minute with fairly strenuous exercise, which is only about 300 calories in half an hour. So imagine going to the gym, running on the treadmill for 30 minutes, you burn 300 calories. 300 calories is nothing. It is a candy bar, it's a snack. So the only way to control weight is to control what's coming in to our bodies. That's what the operations help us to do. Again, that's what the satiety factor is, and that's what our goal is. Exercise helps because it burns calories on the other end, and it's good for health, but you cannot make up for poor eating habits by exercising. There's not enough time in the day for that. Okay, so let's talk about the operations. Here's the sleeve. And let's see. With the sleeve operation, again, all three operations were reducing the size of the stomach in one way or another. It's just different in each one. You've already seen the difference with bypass versus the band. We're cutting through the stomach with the bypass and moving the intestines around. With the band, we're just putting a band around. Sleeve is in some ways kind of in between the two. We're taking out most of the outer part of the stomach, so we are cutting part of the stomach like we do with bypass, but there's no rearrangement of the anatomy. So food still goes through the same channel just like it did before. We're not putting any new device or foreign body in like the band. So with the sleeve, what's happening with the sleeve, as you can see on the video, stomach at full size, when stomach hasn't had an operation, stomach is very distensible. In other words, when you eat food, it can dilate, it can grow. The outer part of the stomach is really what's responsible for that. So with the sleeve, the way we reduce the size of the stomach with the sleeve is if you imagine a banana connected from the esophagus tube down to the small intestine, we essentially cut on the outer part of that banana, and the outer part of the stomach we remove. Again, it's that outer part of the stomach that can stretch and really grow. The inner part of the stomach doesn't stretch much, so that volume that we reduce the stomach by is greater than 90%. So even though there's a tube of stomach, which seems to be larger than like with the bypass, since it's on that inner part of the stomach, it doesn't dilate, and so the volume is decreased by 90%. Now, some of the differences between the sleeve compared to the band and compared to the bypass, because each one has some differences and there's some benefits and some disadvantages, and everybody's going to kind of be able to decide what they feel is best or right for them. There may be medical reasons to do one operation over the other. However, the criteria is essentially the same for each of the operations. There's the exception of the BMI dropping to 30 for the band, but the criteria for the most part is the same for any of the three operations. But one difference with the sleeve compared to the band is there is no foreign, there's no addition, we're not putting anything into the body, so there is no a balloon to adjust or that type of thing after surgery. Compared to the bypass, we're not moving the intestines around, so there's not that issue with vitamins, like vitamin B1, B12, and those kind of things. So of the three operations after surgery, the sleeve tends to be the one with the least maintenance because those things should stay normal, and we aren't adjusting the band balloon in order to keep it going. So again, differences between each of the three. All three operations are very effective. Someone can, with any of the three operations, can lose all of their excess weight and keep it off for the rest of their life if they follow the guidelines. But we're going to talk about that next as far as what are the guidelines and what do you need to do to be successful. The operations are very effective and they help you to make those changes, but you need to work with it and make some of those lifestyle changes in order to be successful for the long term. Everybody can lose weight short term. You can do that with a diet. So even though the operations have become more effective and safer over in recent years, there's still risk to any operation. So unless you're going to get the most out of it, doesn't make sense to have an operation if you're not going to work with it in order to be as successful as you can.